Hey Morgan, I was recently talking to a client that was unsure about getting into a program or continuing her current program while they're pregnant.
Let's take it to the bikes and talk about it. So, I am a big fan of talking to people who are either thinking about getting pregnant or are pregnant and exercise because I think it's really important for women to prepare as this is one of the biggest physical fitness events of your life.
Yeah.
And so there's a lot of old kind of knowledge that's still, or I should say, lack of knowledge that gets passed
Myths.
around, myths that get passed around, and especially in our field where we're doing strength training and we're pushing people pretty hard. And so one myth is that you shouldn't train to failure or train as hard when you are pregnant. And all this, I should start off the video by saying, always talk to your doctor first. Your doctor knows best. And they're, especially if you have any health conditions or anything like that, working with your doctor. But if you've been generally healthy and you've been exercising, especially, there's no reason to kind of stop doing what you've been doing and continue on unless your body's telling you, not to keep doing those things.
Yes, listen to your body.
Listen to your body. But outside of that, there's no reason not to train. In our style of training, we train to momentary muscular failure, which is pushing your body pretty hard, but in a safe way. And that's super important for still continuing to try and improve your muscle mass and your strength. And as someone who's trained a lot of pregnant women and gone through it myself, I can say that you're probably not going to make huge strength gains while you're pregnant, but you're going to keep moving your body. You're going to feel strong, and you want to be strong going into labor and delivery, but also being strong for while you're pregnant. I gained a lot of weight during my pregnancy, so I wanted to be strong enough to be able to still hold good posture, walk around, do a lot of the things that I do in my daily life. And that's
And
what a
then be
lot
ready
of
to carry the child physically afterwards.
exactly. So, I read things too like, oh, when you're, really pregnant, you shouldn't do lunges. But one of the places you change your baby's diaper from the floor a lot, and then you have to get up from the floor, which is essentially the bottom range of motion of a lunge. So I think practicing those movements and being strong, you might have to modify. I know that I modified my weights towards the end of my pregnancy because I was just so tired. But I still pushed myself, and I've done that for other clients too, and it's perfectly safe and healthy, and women feel good during that and because of that.
Yeah, for sure. And then one of the things that we do for strength training is try to get people into a full range of motion. And that is where, when you are pregnant, you're actually releasing a hormone called laxin. And then if you are listening to your body, the body might be able to go into that range of motion, but it's actually further than what you would have before being pregnant too. And that can cause extra stress and strain on the muscles and joints, which is not in a good way. So that's where like limiting range of motion while we're doing these workouts is very important. And then also, again, like listening to your body for the entire time. But that's where an experienced trainer, if you have anything going on with your body, like always like consult with your doctor beforehand too. And then we can always talk to them as well and see what the plan is and go
Yeah.
forward through that while we're here at Breakthrough Fitness.
Yeah. And if you're someone who hasn't been exercising, but you're, thinking, oh, well, I wish I would have, and now I can't get started, because that's another myth,
Yeah.
is that you shouldn't try new things while you're pregnant. And that's kind of been debunked too, especially if you are someone who was typically really sedentary. Now, if you were really sedentary, I wouldn't recommend, working out 60 minutes a day, 7 days a week.
Ease into it.
Ease into it. But that's what we would tell a healthy individual too,
Yeah.
someone who's not pregnant, no health conditions. We still wouldn't write them a really intense multiple days a week program. You should always scale your program appropriately, but there's no reason.
It's going to look different for every single
Right.
person.
Totally. And again, that's where like talking with your doctor, making sure it's okay, but there's no reason why you can't start. And again, I can't iterate how much like having a baby is a big physical feat that you want to be prepared for. You would never sign up for a marathon and not train. So I feel like not training for having a baby, clearly it's something I'm really passionate about.
Hence the question today.
Yeah. Well, and I like women to feel empowered going into this big thing, because especially if it's your first, or if you've had multiple, and maybe you didn't have a great experience a first time around and you're having a second child, we are all about building confidence in your body. And I think that's something that strength training does for you. And one last quick myth is the heart rate myth.
Yeah.
So you want to talk about that, Matt?
Yeah, you just want to maintain the heart rate at a certain time, but then also like making sure we're not going like super high during that strength training
for
routine.
Like long periods.
Period of
you can
time.
Get your heart rate high,
but we just don't want it to have it to be that flat like plateau of that high mark, and having those peaks, but then bringing it down. So that change in heart rate is totally fine, but just not having that long bout of a high heart rate during any type of training.
Yeah, they used to say keep your heart rate under 140, which when I was pregnant and going for walks, my heart rate would get over 140. So that's like impossible.
Well, the flight of stairs,
anytime would get you over 140. But you just don't want to be in that sustained, really high, like Matt was saying, because that can sometimes trick your body into thinking like, oh, it's time. So the later on you go, but also it's really hard to get your heart rate up that high and keep it that high. So, but if it gets up and then comes back down, that's totally fine. And again, that's a little bit too dependent on your level of fitness. If you're someone who was working out, running, strength training multiple days a week, you're probably going to be a little bit safer keeping your heart rate higher versus someone who was sedentary. It's all very personalized. So that's something we work with clients on too, and other professionals can. So,
so like with recapping all this is definitely get a conversation with your doctor if you are trying to continue your current routine or starting up a new one. Make sure that's safe and okay. And then easing into that routine is huge. It's like those myths that we talked about with getting through to not being able to strength train while you're pregnant, like that is totally a myth. And then having that to be appropriate and scaling it the entire way. So if you're feeling like it's too much too soon, that is some time to like, all right, we're going to back off, continue on what we're doing, because that's going to build the foundation to have a great pre and post-op for everything with pregnancy. So yes,
and we can follow up at a later time with some postpartum fitness myth busting. So stay tuned for that. Otherwise, we will see you next time.